Welcome to the Inspired Hygiene Podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Hello, everyone, and welcome back to the Inspired Hygiene Podcast. As I've mentioned before, this season is all about how can we all work together, strengthen the team, and that powerful partnership between hygienists and dentists. And so I'm super excited to have Crystal Spring joining me. A lot of you know Crystal, and she and I had followed each other and knew each other online. And I think probably met in passing, but we really got to have a conversation recently at the Dental Entrepreneur Women event in Charlotte. And if you don't know what that is, I encourage you to check it out, dew.life. We can link it in the show notes. And just an incredible organization for women in dentistry. And so Crystal and I realized we have a lot of the same kind of mindset around dentistry and teamwork and where we're going. And so I'm excited to have her on and hear her perspective on, hygiene and where we're going and how we can begin to, mend these relationships and strengthen these partnerships. So first, though, Crystal, I would love for you to share with everybody a little bit about you and about Smiles Across Montana. You're the executive director. And are you the founder of Smiles Across Montana?
Yes, I co-founded it. Yeah.
Awesome. Tell us about it. I can't wait.
Almost 9 years ago. So
Fantastic.
Smiles Across Montana is a mobile nonprofit. So we essentially bring the entire dental office into schools, nursing facilities, community centers. We're more portable than mobile. We do have mobile, but portable. If you go to our website, you can kind of see how we wheel everything in to a facility or a school that we're going to be at. And we are solely a nonprofit at this time. We mainly sustain on grants. So I've learned to write grants to make this happen. We bill Medicaid and insurance. And then we have a scholarship program for people who can't afford our services, but don't have any assistance any other way. So we essentially bring, like I said, the entire dental office into a school, nursing facility, community center. And we're just centered around whole health also. My whole outlook on what we do is that if they could be our patients could be receiving better care somewhere, I wanted them to go there. So I feel like we've been really innovative. A lot of times when you're working in rural or public health, you might be the only healthcare professional that sees someone. So our hygienists, our dentists, our entire team has to be the best that they can be for every patient. And I absolutely love what we do. I've been a hygienist for almost 30 years. I love the practice I worked at in my hometown, but I think sometimes public health is a calling that you're just called to do. And I feel really lucky to, been able to make all this happen. I couldn't do it without my team. I have almost 30 people who work for me now. And we see a lot of patients throughout the entire state of Montana. And, if we want to, we can go into it. We started out 2 hygienists working with what's called a limited access permit. And there were a lot of barriers to that. And there was I'm going to be really honest, a lot of people were scared of what we were doing. And our business was under attack a lot. And then we made the bold choice and just asked a couple dentists if they'd want to work for us. And that's where that whole teamwork approach really started. I think I came in really scared to ask anyone, like no one would ever help us. And I'll tell you right now, I've told so many people, actually, we're okay right now. We don't need any more teledentistry help, or we have a dentist doing this procedure or that procedure. So
that's wonderful. So you've got that team built. So I wanted to ask you about that, the limited access permit. So we obviously have folks listening from everywhere, from Oregon and Montana and Washington, and places where hygienists have, expanded duties and different abilities to reach different populations. To, I'm in North Carolina, and our duties have been expanding over the last few years, which I'm really grateful for, but we're not yet, where you're experiencing what you are and the abilities that you all have. Can you explain a little bit about that direct access permit, and then talk a little bit more about what were you seeing that you felt like, you know what, I really want us to have that team approach and have all parts of the dental team working together?
Yeah. So the limited access permit, I was a big part of the Montana Dental Hygiene Association. I still love my association and in contact with them, you know, part of all their email chains. Absolutely love the work that they're doing. But we all were kind of, the word limited access, you know, feel like it
Mhm.
could have had a better name, but
Mhm.
it is limited access. We were, for the longest time, allowed to go into nursing facilities, um, any public health, events like community center events and Head Starts, but we weren't allowed to go into schools. It said they just passed some legislation just a few months ago that limited access permit hygienists can go into schools. And, this is somewhere we knew that we needed to be. There's so many kids in the school system that needed the services that we bring. I will tell you, we do a lot of minimally invasive dentistry in our program, and I'm going to do a little plug for that. We're actually
Mhm.
being highlighted in a documentary called Invasive. It's with Chart House Films. I can give you a link to that later. Jeremy Horst is part of it, Dr. Johnny Norris, and our team, just so many awesome people. Sarah Litke from Washington, she's part of it, her hygiene group. But we started out with just 2 hygienists going into Head Starts. And we weren't actively looking for places to go. People just heard that we could do it and that we had created this nonprofit. And it went fine, but there were so many barriers. There were so many things. First of all, we couldn't get paid for as dental hygienists. Like the work we do, if I billed it under a dentist and we were under a dentist, then we could get paid for those things. But financially, it was really not as sustainable without being the entire team. And then we did get a lot of people were really scared. I think that that's something in dentistry. People are scared of people starting their own practice. I don't think they necessarily really were scared of where we were, because we were seeing people who wouldn't get to the dentist at all. But I'm one of the only hygienists in the state of Montana who's ever had a complaint against their license. It was a really, really
Mhm.
hard time. Both me and my co-founder, Kara Reck, we were a mess when this was going on, and we were accused of seeing kids that were in the program was called something like a day school or something, where it didn't sound poor enough, I guess I would say. And the group that wrote this complaint against our licenses thought we were working in a more affluent daycare setting. And so we were turned in. It took about 3 months to resolve. I mean, that's a pretty scary time when it's your license
Mm.
on the line. And it took about 3 months to resolve. And when it came back, we had checked out everything. The group that we were seeing was actually under a grant from DPHHS. They were even poorer than you would need to be to qualify for Head Start. They were
Wow.
people who really needed the care. So we went through a lot that way. And in the middle of this, we're still standing true to who we are and what we do. Of course, we weren't seeing anyone we shouldn't be seeing. I think that when we think about autonomy for dental hygienists, we think that, obviously we were nervous and scared about what we were doing. And I've never seen anybody dot their I's or cross their T's as well as we did. And so that was a really, really hard time. But we went in front of the board of dentistry, and one of the dentists that was at that meeting, we were requesting to be able to go into schools. It says in our guidelines through the Board of Dentistry that limited access permit hygienists can work in certain schools, but there were no real parameters around it. There was really no way to know what schools. And so we were requesting schools and it got voted down. But one of the dentists that was there that day, there were two lady dentists there, and they wanted to support us. And that felt really great. But they were just like, they couldn't at that time. And they said, if you can't find a dentist, then I'll be your dentist. And I didn't even give them time. I called them the next day. I'm like, you can be our dentist because I want to go into schools. I think the perspective that I've taken, or the path that I've taken, has been, we're really mission based. I always think what is best for the greater good, not what's best for me. And what was best for us at that time to move ahead faster, see more people, was to actually bring a dentist on. And since that time, we've had a dentist over every single patient we've seen.
Okay, so even though you had that ability to be in certain areas as hygienist solely, you saw that it was going to be just a more fluid approach, right, for your patients if you have a dentist, you have dental assistants, and then
And I will
it
tell you, my dental hygienist like having a dentist to consult with any questions that they have. They feel safer out there.
Mhm, mhm. I want to refer to a podcast that you recently did with Stephanie Botts. I listened to that and it was really good. And you talk a lot about the minimally invasive approaches that you take. So we'll see if we can link to that, because I think that would be a really great supplement to this podcast, because you get into a lot of the clinical pieces of that. And I think so. I want to talk a little bit about what you were talking about. People were scared. So I've seen that too in other states, where hygienists, are trying to serve a need and they're trying to be innovative. And, maybe they misunderstood the Practice Act, or they thought they were within it and they weren't. But there's a lot of reaction and fear from the dental board against that. And so now it's interesting that we're also seeing a lot of fear from hygienists around expanded duties of dental assistants, like the oral preventive assistant. So I mean, gosh, we could go into this, but where does that fear come from? I mean, it's just it's a really kind of a territorial thing, but I think it's also just not fully understanding what the intent is of it, or maybe not looking outside of your immediate situation. So for a private practice dentist that's working in a suburban area, they may or may not have any awareness of what's happening in these rural, communities, or Native American, communities where they have zero access to care. And some care is better than no care. And there's always an argument of, well, but someone, our oath is for medicine and dentistry and dental hygiene is to do no harm. So we certainly don't want to do any harm, but we're doing harm by restricting the capacity to care. And that honestly is now, right now, I talk to dentists, dental practice owners every week that are in urban or suburban areas, and they do not have the dental hygiene capacity to serve their patient base. And patients are being booked out for, 4, 6, 8 months. And there is a direct relationship to how far out they're booked and how proactively they're diagnosing periodontal disease. And it does not matter. These are not, poorly run dental practices that have old equipment or run down. No, these are modern dental practices that are having these challenges, and it is having a direct impact on patient care. So your perspective is, you're coming from the nonprofit public health kind of arena, and what you're seeing, I'm coming from the private practice, and yet we're still seeing similar problems. They're coming at it differently, right? Like I think yours are more of a location and socioeconomic based situations. This is more of a staffing capacity situation, but it's impacting that. So what's your take on, and this is I think we need to just be real on this podcast or else we're not really getting anywhere. But what's your take on the role of dental assistants in expanding preventive care opportunities? And then, what about this, expanded scaling duties for OPAs? What are your thoughts around all that?
Yeah, I think that it is a really hard subject, and I understand why people are upset about it. We don't have autonomy as dental hygienists. And what I think of when I think about autonomy, I think of you've got California. Yes, they can have their own practices. Colorado, it has can have their own practices also. How many hygienists actually run their own practices? There's still most of them working with dentists in some capacity, and it's more of a referral basis, and you see how well they get along. So I kind of want to bring that into it. But when I think of autonomy, I think of us as dental hygienists being able to decide what services we can do. I know that there's dental assistants in our country who can do local anesthesia, and this is happening before all of our states can do hygienists can do local anesthesia. That, you know, I'm not saying I'm for that or against that. I'm just saying, wow, if we had autonomy, we could actually decide what we feel comfortable doing. Of course, we should all be doing the same things throughout the entire nation. So in some states, you can do ITRs. In other states, you can't. We had to fight to be able to put on SDF a few years ago. Like, wow, but you can, a CNA or anyone in the medical field is a little different. So there's a lot of restrictions. I think hygienists would be and I think we see this with like California. My goodness, I think their board keeps their hygiene departments in check. I feel like they do a really good job. I actually think like who'd be harder on hygienists than hygienists. We're going to have people toe the line. And I think from how we're educated too, that's always something that we're thinking about is I mean, we're perfectionists. We want to do everything really, really well. But what we're seeing, and you were talking about these offices being like scheduled out, but a lot of these hygienists are working 2 columns at once too. So we do have to find some way to alleviate this. And dental hygiene school I just talked to someone today and they mentioned that it was 2 years. I'm like, I don't know anyone who's went to dental hygiene school in 2 years. Like we don't even have to go into that, but that's just absolute craziness. So when I think about the OPA and working in public health, but even working in private off practice right now, it's almost half the people in the United States don't go to the dentist. So how many people do we have walking around with disease? I think that we need to change the way we do dentistry too. We have to have a focus around empowering people to take care of their own hygiene. If we can't get people in, 6 months might not be the date anymore. It might not be a 6-month recall. There are so many people going without care. And that's really scary, especially for your people who are walking around with autoimmune diseases and heart disease and all these other markers. But yet, we're still giving the same time to a 16-year-old who just needs to learn how to brush their teeth. So I try to focus on those things. We've hired on community healthcare workers and really started teaching them how to help us with education. Because also, in a cram appointment, you don't have time to be talking to people about these are the things you need to be doing. Show me how you brush. Actually, this is how you need to do it. So I think that approach, using the OPA from everything from education to if trained correctly, I will use the OPA when it's legal in my state. We're going to have to.
Mm-hmm. Mm-hmm.
And I've seen some amazing dental assistants over the years. I've learned a lot from some amazing dental assistants. We don't have EFTAs or the expanded function dental hygienists in our state either. I wish we did because there's a lot of things we could be doing. I look to states like Washington. My goodness, I think that the dentists in Washington probably really appreciate those hygienists and all the things that they could be doing. So while we're talking about and thinking about them scaling, and they're not talking about them doing periodontal scaling either.
Correct.
And unfortunately, people have been scaling with no education whatsoever for a really long time, and we all know it. It happens in your pedal practices all throughout the nation.
Yeah.
So I think that if we could come together to decide, like, how are we going to do this? What training do they have to have? And who better to train them than hygienists? Like, I'd love to see that. I don't know if you remember this from a few months back, but it really just hurt my heart. Tina Clark, who teaches local anesthesia, she actually taught the first dental assisting school out of Oregon how to do local anesthesia. And I watched how people who should be loving this woman attacked her. She wasn't the one who passed the bill. She didn't make this happen. But if you think about who you'd like to have teaching those assistants how to do this work, I can't imagine anyone better than her, because they're going to learn how to do it right.
Yeah. Yeah, absolutely. So I think it's all about opening our mind and looking at the big picture. And when there's an attack like that, the question is, what are you afraid that these dental assistants are going to take dental hygienist jobs? Because that I'm not afraid of that.
Not afraid.
Excuse me. And I think the other thing, though, if I really think about this, and I'm trying to figure out how to say this in a succinct way, here's what I observe, because we look at a lot of practices across the country, and most of the practices, and again, these are progressive practices, and most of them, they are grossly underdiagnosing periodontal disease, and it is being treated in a prophy. And so if the hygienists are seeing these patients that have active inflammation, um, and they're working really hard to try to treat this periodontal disease in a prophy, because either their doctor and their team, they don't have a clear, standard of care, or they're so booked out, they're just doing the best that they can. If they look at those patients and they think, oh my gosh, there's no way that a dental assistant could learn to do this, I get that. But what if you have a really clear standard of care and you have a hygienist that is screening these patients very thoroughly? They're getting a comprehensive periodontal assessment by a dental hygienist, and the dental hygienist is a very strong diagnostician and is saying, you know what, this patient is appropriate to be seen by an OPA, and there's that oversight there, then man, it could open up so much opportunity and time to be able to get patients in and get those that really need that skill and attention of a dental hygienist in with the dental hygienist. So I think if we look at the broader picture and not feel so threatened by it, I think that there's a way that we can work together. Now, I talked to another hygienist today, and she was reflecting back, in 2010, and at that point in time, there were not a lot of hygiene jobs in her particular area, and I think that's probably what the fear is that this is going to, turn into something where those OPAs then can become a hygienist without going to dental hygiene school. I know that's also part of the, concern there, but I think for right now, like, we need some solutions to this.
Yeah, well, people, especially after COVID, we all realized that our mouth didn't matter. Like, that if your neighbor's unhealthy, you're going to be unhealthy. Everyone needs help. Everyone needs to be seeing a dental health professional, whether it's a hygienist, a dentist, dental therapist, and in some instances, it's going to be an OPA. I would say the OPA is coming. It's needed. I know that it's coming. I think we need to figure out how we're going to deal with it and stay on board, and how we're going to advance our profession. I do want to say that I think when people are scared of things, the first thing they need to do is they need to be a member of the American Dental Hygienists Association. I feel really strongly about that. Support your states, know what you're talking about. A lot of times people don't even know what they're talking about, and it could be really detrimental. So I really want to put that out there. Support your state association, support the American Dental Hygienists Association, because that is the only voice that you really have a lot of times. And I'll always be a member. But that being said, I don't see the OPA as a threat to my work. I never have, though. I'm going to sound a little cheesy, but I'm an abundance thinker. I'm like, even if other people want to, now that limited access permit hygienists can go into schools in Montana, even though they're going to do it differently than me, let's help them all.
Yeah.
I want to make sure you're doing it right, because in mobile and public health, I don't want anyone making mistakes that would hurt our entire mission. But I think that if we go back to that abundance mindset, I want to be able to do ITRs. I would love to be able to do fillings. There's so many things that I would just love to be able to do that would just increase my how valuable I am in a practice also. So not just thinking about scaling. Scaling is one part of our jobs. We are so well educated. And I think that in the end, I think all of dentistry will probably be absorbed by the healthcare system, by medical. And how are we going to really use our educations and what we know? And it's so much more than scaling. Like, how are we going to help our patients keep themselves healthy? Because we're proving to ourselves right now, we can't see them all. So how do we teach them to keep themselves healthy? How do we bring the most valuable education to our patients that's possible? To me, I think that's even more important. I think all of these minimally invasive tools that we can use as kind of mid-level providers, like, get those things passed in your state, be using some of these things to then keep that important, like, time that there's services that only the dentist can do for that. Or if in some states, assistants can't do sealants. I mean, that's crazy. And
Yeah.
especially we use mainly glass ionomers. I could teach anybody in 30 seconds to a minute, like, how to do a glass ionomer sealant. It's crazy easy. And maybe that's an exaggeration, but still, these are crazy easy things. And I do understand what happens when people start feeling fearful of not being relevant. We have seen people be treated awfully in some environments, and I think that's where that comes from. But what can we really do about it? I don't know. I think that we want to show up with solutions and not just being seen by the general public, because I've thought about this a lot. If you were to go to your senators and just anyone in the general public and try to explain to them why you don't think dental assistants should be able to do something, and you're showing this huge need, it's the same with the dental dentist. Like, they're going to have a different idea of it than you. Like, in some aspects, we are protecting our profession sometimes more than we're protecting people's overall health and what people.
Yeah, and I think too, if we're feeling really threatened about that scaling piece, right? And it's, there are limitations around that, obviously. Now, whether or not those are honored is up to that individual practice. I would hope that they would be, right? We kind of touched on that. Um, but I would say for hygienists too is like, okay, then this is a call to step up. And just like you said, there are so many different services that we can offer. So don't make it just about scaling. Demonstrate that the hygienist is so much more, that we are, total body healthcare practitioners. And I'm assuming in your organization that you were talking about how very often you all are the only healthcare provider that these patients are seeing. So what that means is that you all have to really be looking for signs and for other conditions that are completely outside of your scope of care, but that you can point those patients to. You know what? I noticed you've been working really hard on your home care and you have a lot less plaque, but your gums are still bleeding. Do you have a way to get to a doctor where you can get screened for diabetes? Or doing chairside glucose testing and things like that, that maybe you're already doing that, but there's just so many different levels, even in dental hygiene, that's where we need to go. Is, yes, we need expansion of duties, but in so many cases, the hygienists unfortunately aren't even working to the level of the license that they currently have. So let's look at where we can expand that. And I know my point is not to give hygienists a hard time, but I see it. It's a fact.
Yeah, I think about, like, so much of we all come from a different perspective, and there are so many amazing hygienists, but I have to say there's a lot of just dentists that love their hygienists and so appreciate them. I think that we get a little fixated on those that don't. I think that the general public also understands what they're paying for. They know. I mean, they know if they're getting good service or not. They can tell if their hygiene gets worse or if things aren't being removed. I worked in perio for years, and my goodness, I mean, they knew their probe depths every area that they were. And I mean, it's just absolute craziness. I'd get a little nervous sometimes. Like, I mean, and we're such hard judges of ourselves, you know. But again, just being able to expand some of those things, where I've been teaching at Montana State University, the School of Nursing, for since 2018. We started this medical dental integration project where we show nursing students all the things that we do. We show them about minimally invasive care. We teach them about home care and, all the links between periodontal disease and cardiovascular disease and early birth weight and, all the things. And they're so appreciative. And to me, I've had people come after me before, like, why would you be telling nurses that they can apply SDF? It's because my job is too big and I need them to buy into this. I need them to be a part of it, that it's not about me, that it's not about my job. It is about the health of Americans, of our neighbors. People don't have access to care. And I would just tell people, like, maybe the office that you work in, you might be a little nervous, but it is unbelievable what is actually out there. We will go into schools, and I'm not going to say that my team is numb to it, but seeing big holes in teeth and kids not crying, fistulas draining, just is a normal everyday for us. And we work in all areas of Montana. We're in rural areas and more urban areas. There are people going without care everywhere. And the whole team approach is how it works better to me. It's not just the hygienists that are taking the intraoral photos. We're teaching other people to do those things. We don't necessarily have to have a dental assistant, but we're making sure that our community healthcare workers, we're even having them trained they go away for a week and they're getting training on how to do x-rays for us, all these different things. But I need somebody to take the blood pressure. I need people to look at people's overall health. Like, we can't skip a beat. And your average hygienist in an office doesn't have time to do all that by themselves. So we need to work together. And to me, I think public health is probably a little bit different. And maybe I also think DSOs are a little bit different too, where you don't have the practice owner. It's not like a them against them kind of situation. It's more of, we're a team. I think any of these situations where you're getting to work as a team, you have a little bit different perspective on what's going on out there in dentistry.
I mean, I love it when we encourage all of our clients, regardless of their, practice setup, to, work as a team. And I know you do too. And so many dentists are so great at that. It's like, hey, I couldn't do what I do without my team. And so the whole point of this season of the Inspired Hygiene podcast is to really begin to heal this hygiene doctor tension, and rebuild that powerful partnership between hygienists and dentists. And so I wanted to talk to you about your perspective on access to care, and not only access to care in these rural and poor communities, but even access to care for people who have a dentist, who feel like, this is my dentist, but I can't get into that dentist. What are some solutions there? So I'm glad we were able to talk about that, and also how to really set ourselves apart as hygienists. And I really believe that the vast majority of progressive dentists, that's what they want. They want to see their hygienist step up. They want to support their hygienists working at the top of their license. I think a theory that I shared earlier on in the season is, I think that there's 20% of hygienists are creating 80% of the kerfuffle on social media, and attacking the hygienist who's training dental assistant, that's a small percentage of hygienists that are really making a lot of, noise around that, but it's created a wave of tension across the whole industry. I think there's another 20% on the other end of the spectrum that are creating incredible outcomes for patients, that are really stepping into that role as healthcare provider and are truly helping patients heal medical conditions through improving their oral health, who are embracing technology and really working at the top of their license. And then there's the 60% in the middle that are open. They're just not sure what the next step is to take. And
Yeah.
they're waiting to be activated either by their doctor or a fellow hygienist or someone like, that they listen to on a podcast. And there's so much room for just that positive growth in dentistry and in dental hygiene. And I'd love to know from your experience, like, what do you think are the next steps for dentists and hygienists to start to heal that relationship?
Yeah, I think that, I do know from years of legislation and just wanting to make things better in my own state, and from what I've seen, when we fight, it doesn't get us anywhere. I really believe that we need to sit and meet, and I'm really proud of our state association. So the Montana Dental Association and the Montana Dental Hygienists Association right now are really working well together. They actually have, like, they came together to get this bill passed for hygienists to be in schools. And I mean, I was amazed. I was blown away that we could actually make this happen. So, but they met together. They were open to talking. The dentists weren't fearful. They're seeing the issues that we do have. And I want to be really honest. I have to say this as someone who runs a business. It is not easy, and not every hygienist, if we had autonomy, would be out there owning their own practices. That just would not happen. The amount of, even in public health, it's right around $20,000 to $21,000 a year that we spend just on insurances.
Wow.
And those are basic insurances that anyone who has a business should have. I wouldn't now, knowing what I know now, I would never open a business without any of them. And so these aren't really things that are an issue. But I do believe that hygienists would govern themselves wonderfully. Do I think that's going to happen? Not in enough time for me. I'm a fast action kind of person. I've had groups say, like, we were going to have some type of partnership with a tribe or a school, and, they weren't ready to do it yet. I always say, well, let us come in, let us do it how we're going to do it. And when you're ready, you can take it over. And sometimes it never happens. Sometimes they show up in some way and we come up with a partnership. But to me, we don't have the time. Our patients don't have the time. Our healthcare system doesn't have the time to wait for us to wash this out. And I do believe that the OPA will come about. And I do hope that we'll stand behind those hygiene leaders who are going to train these assistants and finding a way to make them compliant. And I have to say, maybe there's some dentists out there, groups out there who really don't care what it looks like. But I'd say for the most part, from the dentists that I talk to, and I do think we talk to the cream of the crop, though. I do think that we all know, like you call a lot of the hygienists, are total unicorns, amazing hygienists that we know that are probably the ones listening to your podcast because they're the ones always wanting to educate themselves, make themselves better. I have no fear for them at all having a job. These people who are keeping themselves educated that are part of that. But there are those dentists out there also, and they want excellent care for their patients. They don't want to be doing the prophies either. So the prophies, scaling and root planing, like, we all know these things take time. So I think just coming together, I don't think it ever helps to come on the attack. That's how I would put. I think about that with my husband and boys all the time. A good way to get nothing is to come in angry. So
Yeah. Yeah, I would agree. And I've seen that as well in our state and others, is when the olive branch is is presented and received, and figure out, hey, how can we work on this together for, again, a win for the patients, the hygienist, and the dentist, that's when things happen. So being able to just come together in that way and move forward is so critical. Crystal, you have such a really cool perspective on this. And thank you so much for sharing that with everyone that listens. I told you, I don't know how this will happen, but I would love to just come out and just see what you do and observe. And
I would love for you to come. And I do have an opportunity, if that's okay. So it's the 27th of March. We have a mission clinic that's centered around mental health that we're doing. I think Dr. Jeremy Horst is coming out again to help us. You can get a volunteer license in the state of Montana for like $20. It's an amazing event. It's centered around, we have Montana State University has a really large intertribal powwow that weekend. So we'll be seeing MSU students, community members, the Latin community, and then tribal members who are in town that weekend. Like, it's going to be an amazing event. So they can go to our website and find out more information about that.
Okay. Which is smilesacrossmontana.com. Smilesacrossmontana.com. Okay, and we'll put that in the show notes too. And that's in March of 2026.
Yeah, we're looking for dentists, hygienists, anybody who wants to help.
That's fantastic. Thank you for sharing that. Thank you so much, Crystal. It has been a pleasure, and I just appreciate you taking the time to hear. Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com. And as always, stay inspired.